We see that slowly different parts of the planet are starting to realize, this could come here. Yeah. And they're starting to talk about readiness. I fear they're too late, that everybody's dragging their feet and getting ready for this. And I think this is going to really explode.
Going to really explode. It's a dire warning from an expert who reported extensively on the Ebola epidemic and other disease outbreaks. Welcome to Full Circle. I'm Anderson Cooper. The death toll from the coronavirus, now more than 900 people, far surpassing the SARS outbreak of 2003. The number of infected, more than 40,000 people. The largest outbreak, of course, of the virus outside of mainland China is actually a cruise ship off the coast of Japan. At least 135 people on board have tested positive for the virus, including 24 Americans. I want to bring in CNN correspondent Will Ripley, who's reporting from Tokyo. He's been reporting on the passengers on the ship. So, Will, what's the latest on the outbreak on that ship?
Well, the reason why we're here in Tokyo, Anderson, is because we've actually been seeing ambulances coming in, during the overnight hours, bringing those 65 new coronavirus patients to a number of different hospitals. From where I'm standing right now, there's probably 3 or 4 hospitals within a 2-mile radius. Japanese government not saying, who's going where, of course, partially because they want to avoid, I guess, panic in the neighborhoods where these hospitals are located. When we went to one of them to interview an American woman who tested positive, there was no indication that anything was out of the ordinary. We were actually able to walk right up to the window of her room and talk to her. And I think that kind of speaks to the fact that, one, these are quarantine wards that are already in existence, but two, this is not the kind of outbreak that's like airborne and potentially could like spread to the surrounding neighborhood, but that's the way that people are treating it right now. And of course, on the ship, there's some real hysterical people. I mean, people who have young children, people who are over the age of 60 who might have pre-existing medical conditions like, diabetes or heart disease or, a compromised immune system. And those are the people who, if they did happen to catch coronavirus, it could be a really, really bad situation. But I have to tell you, the woman who I interviewed and a lot of other people that we've been talking to, they have the virus, but they're not even showing any symptoms. They're not even taking any medication for it. They say this is a much less unpleasant experience aside from the quarantine than a common cold or the flu.
So you've been speaking to this married couple. The wife has the coronavirus. The husband does not. The husband is still on the ship, and is the wife in the hospital?
Yeah, so it's Kent and Rebecca Frazier from Oregon, and Kent is still in their cabin, which hasn't even had housekeeping service since this quarantine began, aside from people basically throwing some fresh towels through the door every day, because there's more than 100 crew members that have actually staged a bit of a revolt. They actually wrote to the Indian Prime Minister asking him to evacuate all of the Indian national crew members from the ship because they don't even want to be close to passengers that they think might have the virus, because it seems as if almost a foregone conclusion that more people were exposed and might eventually test positive. The reason why we're kind of hearing about this so late is because, one, there's an incubation period, but also a lot of people just haven't been showing any symptoms aside from perhaps a minor fever and maybe a bit of a sore throat. Now, Rebecca, she's at the hospital here in Tokyo, and I know I was nervous because we actually started talking to them before she tested positive. And when the news came, it really hits you in the gut. You kind of start to develop a rapport with these people, and you're fearful for them. But here she is. She's feeling great. Like I said, she's not even taking any medications for the coronavirus. She said doctors just kind of tell her to rest. And she actually told us a few hours ago, it seems like she might be getting out of the hospital before her husband doesn't have the virus, right now at least hasn't tested positive, and he's been tested twice. She might get out and have to kind of hang out and wait for him to get off the ship. She might get out sooner.
So how many people are still on the ship, and what is the plan here? How long do they have to stay there? Is there, is sort of the virus, are new people becoming infected because they're on the ship, or are they all just staying isolated and waiting to see if they caught an infection earlier?
I think it's the second one, Anderson. At least according to the captain of the Diamond Princess, we were able to hear the announcement that he made to passengers, and he said, yes, there are 65 new cases, but this is not the result of a failed quarantine. This is not the result of people. There are some people who are allowed to go out on deck for 30 minutes a day. And the only people who can go outside for 30 minutes a day, for the most part, are the ones that have those interior cabins that don't have windows, and they just had to basically sit there all day with not much to do other than watch TV and, text people and maybe play board games. But they have to stand 6 feet apart from each other, and they have to wear masks. So that kind of, as long as they're adhering to those rules, that limits the ability of the virus being transmitted, because they say it's like droplets, and if you breathe on someone, they could become infected. But they say it's not airborne, so it's not like going through the air vents that are circulating through the ship into the people's cabins. But there are still people. Imagine if you're sitting in that cabin for 24/7 basically, and you have your young kids there, and you're looking up at the air vent, and you're like, well, do I really believe what the medical professionals and scientists are saying when it's my life and my health at stake? And again, I think this also goes back to the we have to kind of try to keep it all in context. There's so much hysteria, there's so much fear, and there are some really horrible stories. And of course, the number of dead keeps rising, the number of cases keeps rising alarmingly. And yet, so far, coronavirus has killed, just over 900 people, whereas every single year the seasonal flu kills hundreds of thousands of people. And people don't really worry too much about the seasonal flu. And so, people do worry, but it's certainly not capturing the world's attention like this. But it's a new virus, and there's always kind of that inherent fear that comes with something that's unknown. So I think we just have a better responsibility, yes, to report all of what's happening, but to also put it in perspective for people, and particularly for those passengers on the ship. The people who are more afraid, frankly, Anderson, are the ones that don't have it. The people that we've spoken with who have tested positive they're actually relieved. They're like, okay, this isn't as bad as I thought.
I think that there's a lot of people, too, just around the world who maybe have been hearing about this, haven't necessarily been giving it that much attention. Can you just explain what you've been told about how the virus how you can actually become infected?
It's person-to-person contact. So if you're breathing in, they say if you breathe in, even if you're like standing close to someone and you breathe in their air, you could get it. If they sneeze and the air droplets, go a certain amount of distance, I don't know how far they can travel, although surprisingly and kind of grotesquely far, you can get it from somebody who maybe sneezed across the room. Obviously, in the case of SARS, they found out that it was transmitted through people's, when they would go to the bathroom, and like it would go to somebody else's apartment from the, person upstairs bathroom. We don't believe that that's happening in the case of coronavirus. But again, they're still learning about it. So that's why on the cruise ship, they're just trying to keep everybody isolated and avoiding contact with other people until the quarantine period is over.
Wow. Will Ripley, I appreciate you being there. Will, thanks so much. Want to move on to the goods, where one last story that hopefully leaves you feeling good after that. This story is incredible. I'm in love with the story. A toddler in Texas is now a viral sensation after her hit performance of the song Let It Go from the movie Frozen sent chills across the internet. Take a look at this. That is 2-year-old Madeline seeing snow for the very first time. She celebrated by dressing up as Elsa from the box office smash. Her western Texas town rarely sees snow, so the young Frozen fanatic was thrilled and prepared for this unique opportunity. She's so adorable. Madeline's mom, Christy, says the toddler is obsessed with the Snow Queen character. Christy uploaded the video to social media for family and friends. She was shocked that it's been shared more than 1 million times and counting. How can you be shocked? Who wouldn't share this? Even the actress who voices the Elsa character in the movie applauded Madeline's sweet rendition. Future movie star melting our hearts here on The Goods. Look the way she's walking through the snow. Oh, I love her. That does it for Full Circle. We'll be back 5 p.m. Eastern time tomorrow. Hopefully Madeline will be back too. You can stream the show anytime by going to CNN.com/Full Circle. Until then, tune Tasty 360, CNN 8 p.m.